I'd like to introduce Janice from the United States, who has rheumatoid arthritis. Welcome, Janice.
Hi, Linda.
Could you tell us a bit about your rheumatoid arthritis? When did you first start noticing problems?
I first had symptoms about 7 years ago at the age of 53. It first started in my feet as pain in my arch and my toes, and over time I started asking my doctor for help with it because it was becoming quite uncomfortable. Right. So that was the first indication.
Mm-hmm. And what did your doctor say?
Well, he sent me to have x-rays on my feet, and when that didn't really show anything, he thought that maybe I had a fungal infection, and he put me on a 6-month antifungal regimen, and of course none of that worked. And then he sent me to a podiatrist, and the podiatrist said that my feet hurt because my arch is so high, and he gave me some exercises to try to stretch the muscles in my arch, and of course none of that worked.
And how long did it take you to get a diagnosis?
It took almost 2.5 years, and then my primary care physician was leaving the county practice to go and work for another agency, and so I had to change physicians. And right before he left, he did a blood panel, and that's when he first saw that my rheumatoid factor was very high.
And then what was the course of action that was taken?
Well, started going to another doctor, and I took copies of all of my labs and everything to her. When she looked at it, she said, "How long ago were you diagnosed with rheumatoid arthritis?" And I said, "I wasn't really given a diagnosis. He just said that it was high." And she said, "Well, I don't like to tell you, but you do have rheumatoid arthritis, and it's pretty high." So that was about 5 years ago.
And how did you discover LDN?
Well, I was going to a rheumatologist, and he's pretty elderly, and even though he is considered to be the best rheumatologist in our small city, he is very conservative in his treatment, and it took him quite a while to get around to putting me on increasing meds and things, trying to help me with my pain and fatigue. And over time, it got to the point that the traditional medicines were giving me as many side effects as I felt as bad as if I was taking nothing. And I thought, there's got to be something else out there. And so I Googled alternative treatment for rheumatoid arthritis, and one of the first things that came up was the LDN website.
And what were your symptoms like the time you found LDN?
I still had a lot of pain and inflammation, swelling in all of my joints, and general fatigue, and I got a little cyst on my face, and it became very infected, and I ended up having to have it surgically removed, and I just didn't feel good generally, and to me it just wasn't acceptable for my life to be feeling like that.
So before you started the LDN, what were your symptoms at the time?
I had a lot of inflammation and swelling in my joints, especially in my hands and in my feet, my ankles, a lot of pain in my joints, and of course the continuing fatigue was a big factor for me.
So who prescribed LDN for you?
Luckily, I work with some doctors at my hospital, and one of the doctors there has a PhD in pharmacology, and she also is very familiar with doing research on drugs and treatment modalities. And when I showed her the information on LDN, she is very familiar with naltrexone for its original use, and she understood how it would work for me, and she was willing to do it, and she's the one who prescribed it for me initially.
And what did you notice when you first started? Did you have any introductory side effects?
No, actually I had no side effects whatsoever and have not had any. Once in a while I have a very vivid dream, but it doesn't disturb my sleep really. So that's about it. That's the only thing.
And how long did it take before you noticed any symptom relief?
Well, For me, it was very quick. First, let me tell you that for over 4 months before I started the LDN, I was taking 800 milligrams of ibuprofen twice a day for the pain and inflammation. And 4 days after I started LDN, I woke up and took no ibuprofen whatsoever that day.
So what were the first symptoms you noticed were eased with LDN?
The pain was the first thing that I noticed. And then over time, I've been taking LDN for almost 4 months now. Pain was the first thing that it helped. And then over the time since then, all the swelling and inflammation is gone from my joints completely.
And what about the fatigue?
Oh, yes, that was also pretty much resolved right near the very first.
So how would you compare your quality of life now to before LDN?
Well, it's dramatically different. I feel very much my old self before I even came down with the RA. All of my energy is back. My husband and I have a very active life. I have grandchildren, and I'm able to just enjoy my life fully again.
That's fantastic. What would you say to other people who are contemplating trying LDN?
By all means, just try it. It's a very benign drug. The side effects are minimal, if any. It's very easy on you. It has, like I said, little or no side effects, and the opportunity that it gives you to restore your quality of life is just amazing. People that I talk to that know me are just amazed at how well I've recovered.
So what would you say percentage-wise that you are back to normal?
Probably 95%. I still do have a little bit of discomfort in my feet if I wear shoes with heels or if I'm on my feet a lot, but other than that, that's about the only thing that remains.
That's amazing. What does your GP think to your recovery?
She is just amazed. She has now put some of her other patients on LDN, and she and her sister, who is also a physician, they practice together, and they are both very interested in doing a study now so that it can be published here in the United States for its effect on autoimmune diseases. They have several patients now that they have prescribed for, and we're very excited. She has people call me and talk to me about how well it's worked for them so that she can convince them to try it.
That's a really, really amazing story, and I'm so pleased for you, and long may the effects of LDN carry on working for you.
Thank you very much, Linda.
Thank you for sharing your story.
I'm very pleased to be able to share it.